Tale of Two Hygienists presents this week's TIPisode. Quick and easy tips to keep you up to date and presented by the experts in the profession. Now, get ready for your unofficial TIPisode. This week brought to you by GC America.
Hi, this is Spring Hatfield, and I am your host for today's TIPisode. And today we're going to talk about patient compliance. One of our biggest obstacles as dental hygienists is to achieve patient compliance. So often, patients do not want to follow our guidelines and our guidance and our recommendations and all the other things that we throw at them. It's a lot sometimes. But there have been study after study after study that shows that patient compliance is a huge factor in a patient's oral health, as you can imagine. We cannot take care of all of their oral problems and prevent oral disease and all the things that go along with it with 2 visits a year, every 6 months. And in some cases, maybe we see them more often, every 4 months or every 3 months. Nonetheless, we can't do it on our own. It's what the patient does every day that matters the most. So one of my favorite articles that I've read over the past few years was published in the British Dental Journal. It was in 2015, and the title of it was 10 Tips to Improve Patient Compliance. And I'm not going to go through all the 10 tips. If you want to read the article, you can. It's absolutely fabulous, and I would highly recommend it. But I did choose a few that are very important that I really think if you focus on these 3, you will have a much improved patient compliance. And the first one is to listen to your patients. Far too often we listen to respond and we don't listen to hear. So patients come in and they have a concern or they have predicted a reason that something has occurred. For instance, if they come in and they say, I think I have a cavity because I just had a baby and the baby stole all my calcium. And I know that most hygienists that just heard that probably cringed because we know that's just completely crazy. It's not accurate. But what I want to encourage you to do is instead of having that knee-jerk reaction of saying, you know what, that is not accurate. Where did you hear that? Or however you want to respond, because I know you want to respond that way, as I do as well. Turn it around on them and ask them a question. So why do you think that your baby stole all your calcium? Has it affected your bones as well? Have you had bone problems, or is it just teeth? And when they respond, they can give you an idea of why they believe what they believe. Maybe their great Aunt Thelma told them that the baby steals all your calcium and they just believe this. And at that time, you can start to kind of educate them on what's really going on in their mouth. And I know that sometimes we're short on time, but if you can just take the time to listen to what's really going on with them, I think that it's a building block on building trust and rapport, which is actually our next big tip, is to build rapport with your patients. And this is usually effortless, but there are times when it's not so effortless. And the best thing I can tell you is to try to find a common ground with your patient. There has to be something the 2 of you can find a common ground. So maybe you both like to read, or maybe you both like a certain time of the year, or you like to travel. Find where that common ground is and kind of build on that. And they will want to talk to you and they will trust you and they will want to hear what you have to say if there is a rapport. If there's a rapport that's lacking, you're probably not going to ever build the trust that you need to be able to help them and to change their mind about some deep-seated beliefs that they have about oral hygiene. So if you're trying to make them make changes, rapport and listening builds trust, which then will help them to make these changes. And lastly, and one of my favorite things to do is motivate my patients. I love to motivate my patients, and there's multiple ways to do it. A lot of hygienists use visual aids of some sort, the flip cards or pictures. I myself have a slideshow that plays on my TV in my room throughout the entire appointment. It's different things like, decay, pictures of x-rays that indicate interproximal caries, and just all things that have to do with dental hygiene and dentistry in general, because some of it is different procedures and things like that as well. But the most effective tool that I've found as far as a visual aid is to use your patient's own mouth. Nothing will motivate them more than seeing what's going on in their own mouth. I use my intraoral camera a lot, especially that is very helpful for showing patients that calculus built up on their lower anterior teeth. And it's also very beneficial when a patient needs treatment that they're reluctant to get. If you can get an intraoral picture of the decay or the crack or the broken tooth or whatever the problem is, a lot of times they're kind of shocked at what they're seeing and they think, my goodness, I need to get this done right away. Whereas before they didn't realize the severity of it and they couldn't imagine it because they don't look at teeth all day, every day. So they don't know what they don't know. I mean, that's just the bottom line. But lately, I have been using Disclosing Solution more, which has been a game changer for me. My patients absolutely love to see what's going on in their mouth with Disclosing Solution. And I know that Disclosing Solution can be messy. I get it. And I know it's frustrating to use whenever it's messy like that. When I was in dental hygiene school, we only had the red liquid Disclosing Solution. It was so messy, so disgusting. It stained everything it touched. It was terrible. And it only showed one color, just biofilm. No matter how old it was, how new it was just one color, that pink color. And Disclosing Solutions have really, really improved over the years. They have some that are multicolored. They have some that have two different colors, a light pink and then a dark purple, which shows newer biofilm and then older biofilm. But I personally use GC America's GC Tri Plaque ID gel. It has 3 colors. It shows new biofilm that's 48 hours old or older, and then mature acid-producing biofilm. So the newer biofilm is a pink color. The 48 hours or older is purple, and then the acid-producing is a light blue. This stuff is amazing. When you put it on a patient's mouth, they are so dumbfounded by all the different colors. And when you explain to them what all those different colors mean, they are really mortified to think that they've been missing that much on their teeth whenever they brush and floss. And it's another thing that I like to show them, and it's really interesting, especially I find on the buckles of 2 and 15, if I put the Disclosing Solution on there and it's purple or pink, if I take the ultrasonic scaler and just kind of swipe it off, that first layer peels off and you can see underneath it the lighter blue. So not only do they have the pink and the purple, but then they have the lighter blue underneath. So it's just piled on top of each other. And that is really eye-opening for a lot of patients. Now, another thing that I love about GC America's Tri Plaque ID gel is that it's a gel and not a liquid. It is a totally different experience because it's not just going everywhere in the mouth. It goes where you put it and it stays there. So it's not just running down their cheeks and all that kind of stuff. It's much less messy. And I've actually dropped some on a patient's cheek and it wiped right off with a wet 2x2. So it's really much better at not staining and causing just a huge mess. So you should really, really consider using Disclosing Solution to show your patients. I think that if you use the Disclosing Solution just once or twice with 1 or 2 patients, maybe a couple patients you're really struggling with patient compliance, and they actually see what's going on and you explain it to them and you see their reaction, it will encourage you to use it more often. And not just that, it makes me a better clinician because I can actually see all the biofilm I need to disrupt. I can't say 100% if I don't use Disclosing Solution. I cannot say with 100% certainty that I am disrupting all that biofilm. I hope I am, but I don't know for sure. But if I use the Disclosing Solution, I can guarantee that I'm doing my job and doing it very well for my patients. So my top 3 things I could tell you for better patient compliance is listen to your patients and listen to hear, not just to respond. Build a rapport with them. Find something that you have in common. Everybody has a little bit of common ground. It has to be there. Sometimes it's more difficult to find than other patients, but you can do it. And lastly, motivate them by using their own mouth. Use what they actually have going on in their mouth to motivate them to make better oral hygiene choices. And that's my TIPisode for today. If you need to reach me, you can reach me at springhatfieldrdh@gmail.com. Have a great day.
Thanks for listening to another TIPisode, and thank you to GC America for sponsoring this week's episode. You can find out more about their great products at gcamerica.com. And don't forget to hit the subscribe button in your podcast app. Follow us on Facebook or Instagram, and head over to our website, ataleoftwohygienists.com, to sign up for our newsletter. And we always appreciate ratings and reviews. Thanks again for listening to your unofficial dental hygiene podcast.